Hello, good evening, everyone.
Good
Good
evening.
evening, ma'am.
Good evening, ma'am.
Good
Good
evening.
evening, ma'am.
Good evening. How are you all doing?
Fine.
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 Fine, ma'am.
So, welcome to the second lecture of the module. And hopefully, the queries of last time have been answered. We will go roll number wise. So, start talking to your respective team members and start scheduling your meetings with each other. And if any group ever wants to meet me or discuss something, so I'm always open to that discussion. Is that
Okay,
clear?
ma'am. Yes, ma'am.
Good. Any
Yes, ma'am.
questions from the last time? Any confusions?
No, ma'am.
All right. So we'll start off with today's lecture. It is about healthcare innovation. So as you all know that healthcare is a field. If you read the newspapers and especially magazines and tabloids and research papers, it is quite evident that the pace at which innovation is happening in this sector in healthcare um, is not something that we can miss being contemporary part of this uh, world. In fact, as we battle with the pandemic, it's very clear that innovation in healthcare, especially with the rapid advances that technology is making, it is something that we must need to apprise ourselves of each other so that we are not only familiar with what is happening around, but we are also familiar with how our academic learning inside the four walls of any college or right now at our homes is being used constructively to solve the real world problems that surround us. So that is why the more we talk about these kind of innovations or make ourselves familiar of it, our ability to think and not only think, our ability to think critically improves. And then we think beyond our academic learning and try to apply what we learn. So, with this introduction, we would discuss today about the multiple few of the innovations in the healthcare which I find are important to discuss. We will start off with general information and then we'll go into particular examples and then we shall also talk about how healthcare innovation could be brought up in our Indian context and scenario and discuss about the possible gaps in Indian healthcare where we could devise solutions to tackle the multiple problems. So, and please remember that this actually shows the reference from which this statement has been taken. Referencing is an important aspect of maintaining academic integrity. Whatever ideas we take from anywhere, we should always acknowledge the authors who have done work before us. So, it's a good practice. So, to say generally, innovation, as we discussed last time, is basically different way of doing things that can bring improved outcomes. Now, what do you think could be improved outcomes in the field of healthcare? What do we call an improved outcome? Any examples?
Early detection of problems based on previous data that we have of people that suffer the same problem.
Right. So, you think that it is an improved outcome?
Yes, ma'am, because we can use their Fitbits and stuff like wearables to monitor their data and try
Yeah,
to find it earlier than it is usually, because people don't necessarily go to doctors until they themselves suspect that they have some disease.
absolutely. So that is one way in which we are improving the ability of a person to detect or diagnose any possibility of disease using their own wearables data. That's one of the examples. Any other example anyone can think of?
Ma'am, something which could make the prosthetics legs and hands cheaper.
Yeah. So in this case, improved outcome is
Ma'am, so that there are many people, disabled people who can't afford them.
right.
So if they that would become cheaper, then most of the disabled persons could afford it.
Right. So we are talking about the affordability as a improved outcome. Good example. Any-
Exoskeletons for military or people who are paralyzed.
Right. Right.
Ma'am, improved health policies.
Could you please elaborate?
Because sometimes government policies they hinder innovation in healthcare.
Right. Can you
So,
think of any specific example, dear?
uh, no. But I've heard like many government policies they hinder like many innovations.
Correct. I think your point is accurate. Why I pushed you to think into deeper is that so that when we know the specific example, we get to know the details of the loopholes and shortcomings in that policy. So, example, if you look at the National Health Policy of India, which came in 2017, which was around last policy was in 2002. So, technically, health policies should be released regularly, but the fact that Indian health policies are released after so much of lag speaks a lot about Ministry of Health and Family Welfare and their commitment to improved health. So you might like to read about National Nutrition Policy, which is also quite new. Then perhaps National Education Policy, which has recently come up 2020. So,
Yes, ma'am. I'll just read that.
so the point you raise is quite significant. Anyone else wants to share an example?
Ma'am, maybe
Yeah.
newer ways of developing vaccines. For example, that I read recently in an article that the Pfizer vaccine, which is currently in distribution, was devised within 2 or 3 hours in a single day. So,
Okay.
like, that is something that people are thinking with newer technologies like the mRNA technology on which the Pfizer vaccine is based. So
Yeah.
that maybe the process which used to take around 5 to 6 years in developing a vaccine for a disease, it was done in a single day, which is remarkable.
Yes, it
So,
is. Yeah. And when we talk about vaccines, let us also talk about the randomized control trials which are done to validate that vaccine. Okay.
yes, ma'am. Yes, yes.
So perhaps we could also improve the way those vaccines are administered to the subjects before they are available in the market. Because for the coronavirus, multiple medical firms have proposed their vaccine and their human trials are in the third stage. It's taking a
True,
lot
true,
of
true.
time, right?
Yes, ma'am.
As much important as the time to develop vaccine is, we cannot look at it in an isolated manner from the time it takes to test the subjects and then finally put that vaccine for FDA approval and then make it available in the market.
Mm-hmm.
Right? So the good thing about perhaps having classes from homes is that we can speak what comes in our minds. So you don't have to hesitate or anything. Just speak out anything that comes in your mind. So any other uh, student wants to share?
Yes, ma'am. Ma'am, may I?
Yeah, sure.
Ma'am, there was some project going on. Like, what I was thinking is, we can take all those computers which are in homes and use some software to combine all of their power to create some supercomputer, kind of supercomputer. Because on network we can use all those devices together to perform a specific task. And so, like, making new vaccine, and there are some more problems like detecting cancerous cells and something like that. DNA analysis that requires supercomputers to work on. So it would be a great idea to combine all those small computers on our home in our homes to create a better system.
Yeah, that is also one very good example. In fact, there's something called as cloud
Blockchain.
sharing. Yeah, and CPU sharing also that exist. In fact, when we will learn about IoT, things like this will come up. So, anyone else we haven't heard of? Okay. So the thing with health systems is that as the world is consistently transitioning into a newer world, there is a very huge demand for them to innovate. But the problem in the health system is, the physicians and doctors generally have a hard time aligning with the new developments in the area. And because generally physicians and doctors are the most important parts, and nurses, of course, most important part of hospital systems. So that is why, taking them together as a team sometimes becomes complicated. And sometimes within the organization itself, there might be some hurdles to innovation that we cannot ignore. And the disease burdens of the entire world is changing. So if you look at maybe not worlds, but it only India's history of the multiple disease burdens, it's very clear that before our young children used to die, so we had high infant mortality rate, maternal mortality rate, and all these kind of things. But now, as with improved technologies and everything, even though we have been able to stem these mortality, but newer challenges have emerged. So, what do you think has become the nature of the current diseases that the world faces, and how is it different from like past 50 years? What do you think? So maybe we can say that as our lifestyle has improved, our ability to be more active has decreased, right?
Yes, ma'am.
And because of that, because of the sedentary lifestyle, a lot of problems have come up. So, for example, nowadays, obesity, childhood obesity, diabetes, and cancer, all these diseases are chronic in nature, and they are very fastly becoming more prevalent, and the incidence rate is increasing. So, as people who are into this business of innovating for healthcare, we must be consistently familiar with the recent developments in our area, because if we don't know, then we don't know how to tackle the problems. So a major part of innovation is to stay informed, to be on the top of our games. If we are not informed, we are missing out on a lot of information, and then also a lot of constructive thinking that we will do after reading that kind of information. So rule number one is always, identify your area or any specific area and try to read about that area, the most recent developments in that area, so that you are head to head with the developments, and then you can think about how a particular solution can be proposed in a particular area. Another example that has prominently come up in our discussions is the health needs of people who are differently abled. In fact, the healthcare of people who are differently able in India is managed very differently from people who belong to Norway or Maastricht or the other developing countries. Because again, you know, when we talk about innovation, always remember context really matters. The solution that applies in, for example, Manchester in UK may not apply to say Patna in Bihar, because the people are different, context is different. The nature of problem might be same, but even then how it is affecting people is different. So all these things are very important to take into consideration when we talk about innovation. And generally, when people show their technical solutions or innovations, sometimes they are just on the basis of what social value it adds in the patient's life. And because when we present any innovation, it's a prototype, and for it to actually reach people, we need finances and money. So social value of an innovation justifies the spending of money on that. So one thing is very important to know that what will be the end result of your innovation, who is the beneficiary, how will it benefit the people who are using it, and there are multiple parameters we need to consider. So in your respective projects, when you think over, draw a very simple timeline. Imagine a person without your solution, what is his or her problem. Then imagine how a person's life changes as that innovation comes into his or her life, and just mentally try to graphically make a picture of that person, and then you will understand the different steps in the journey that you need to focus upon. So generally, the researchers mentioned here who wrote a paper in 2019, they specify that innovative technology displays certain kind of novelty, and these novelty are related to significant health related benefits. Now, when we talk about health related benefits, the definition becomes really very important. What exactly are the health related benefits? Or they could even be a step change in the management of disease under consideration. And these benefits must be demonstrative and distinctive. That means we should be able to tangibly see that this particular technique is actually helping people. Now, to give an example, so for example, there are a lot of, so for example, let's take example of COVID only. Before COVID, we didn't have oximeters at our home. So we were not really monitoring our SpO2 and pulse rate. But after COVID happened, we felt that there is a need for oximeter in our homes, and all of us bought these devices, or most of us. And now we see that because we can monitor our SpO2 levels every day, we can at least check if we are or not symptomatic of COVID, right? So any innovative technology must have these three characteristics. And I have written this in context of healthcare, but if you choose to do any project in any other area, just remember novelty. Novelty should be connected to some kind of benefit, not for the creator, but for the people who will be using this technology. And you should be able to demonstrate it in very clear terms that how that technology or innovation that you're proposing will actually benefit the consumer. So generally, innovative process consists of four aspects. Awareness. So before we begin to solve a problem, we must do a lot of work in identifying whether or not the problem that is in my mind is actually a problem. Does it even make sense? How do I gather the evidence that it is a problem? So we have to be aware, but awareness in abstract term is useless. Even if you are presenting your data, evidence is always important. We always tell postgrad students when they write their essays that please do not make hollow claims in your essays, because claims without evidence lack credibility. And when we talk about awareness, we are essentially talking about the recognition of gap between the expected and actual performance. What is the status quo now, and how will it improve after proposing your solution? So, for example, one student mentioned uh, decreasing the cost of prosthetic limbs. So maybe the expected actual performance right now would be that fewer people are able to access such kind of technology. If the cost is brought down, not at the cost of quality, then perhaps more people can have that prosthetic limbs and have improved quality of life. So the ideal solution would be to develop such a solution, and we have to identify what will that solution be. And this process, you know no innovation takes place in silo. It is always accompanied with lot of interaction with people, lot of brainstorming, and lot of questioning of why and how. And that happens in the identification process. Now, once it is clear in your mind what problem you have selected, what is the solution you are dreaming of, comes the implementation stage, where you, as we saw in the last slide, prepare a distinctive and demonstrative solution of your idea. And the last is, of course, institutionalization. Ultimately, the proposal or the solution that you have proposed has to be implemented somewhere. So what we are doing in this module is not just limited to academic learning or gaining some credits or something like that. It is ideally to provide you a springboard for some idea that you can take forward even after this module ends and possibly deploy it in certain institution. So institutionalization is ultimately important because through that you can reach more number of people. Any questions here? Okay. Yeah. So innovation, as Ness says, is asking the right questions and focusing on the right problems. Now, what according to you is meant by right questions and right problems? Is my voice clear now?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes. So what according to you is right question or right problems? Give me an example. So the best way to carry forward this discussion is give me an example of a wrong question and right question. What do you think? So look around yourselves. What do you think could be the right questions to ask, right problems to tackle?
Ma'am, can you give us one example?
Okay, I will not give you an example, but I will help you to find an answer. So, for example, right questions or right problems are the questions which are relevant to the population you are studying. If I have a question which is right in its own manner, but it is not applicable to the people I'm studying, it may not be relevant. So, for example, if I'm studying Black Americans, okay, and I'm trying to develop, suppose trying to develop a good solution to help them decrease their risk of diabetic complications. So what happens is people who are diabetic generally tend to have failed nerves and lose their eyesight later in their lives. So for example, this burden of diabetic retinopathy is very high in Black people, and I'm trying to develop a solution. And my solution is ready and everything. But now, after developing my solution, I find out that these people are not able to pay for the solution. So for these people, this question may have been right, but not entirely. So that is one example of a right question, which is relevant to the people you are targeting. Yeah. Yeah. Hello? Is anyone trying to speak? Are we connected?
Yes, ma'am.
Yes.
ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yeah. I heard some students speaking, sharing.
Hello, ma'am.
Yeah.
The wrong question or solution would be that for Indian farmers, let's make a subreddit where they can post their queries and other doubts, and the other farmers will help them. But the problem is that not all farmers know how to access Reddit, or they don't know the English language. So the
Absolutely.
right solution would be to make a application for farmers which would be in Hindi or the native languages, where they would post their problems or doubts regarding the farming techniques and other things, and other farmers will answer them.
True. That is a good example.
Ma'am, actually, that is kind of a wrong example because many farmers don't even have smartphones or know how to use apps. They barely know how
Everyone
to
has
work.
smartphones.
No,
No,
not in
everyone
UP.
doesn't
No,
No, no, no.
Okay, okay, okay.
So when such kind of discussion start, stats become important here. In any discussion or any debate you are, never ever underestimate the usage of statistics. Now, one person is saying that the penetration of smartphones in Indian villages or in particular state is high, and which can be debated. So that way, when you are talking about this kind of problem, in your proposal, mention the statistics that even though,
Maybe it's not high in UP.
yeah, possibly, and even if people have smartphones, we cannot be sure that they might be able to
Use
use
apps.
it. Yeah, yeah. So that is one example of right question, which has also been challenged. So you see, uh, different people, we as together bring different perspectives to the same problem, same questions, and that is why working together becomes so important. Because when we listen to different ideas and even counter ideas, they push us to become better, more refined in our problem statement, more intentional, and that is how our outlook of the problem improves, and that is how our solution is also bound to improve. Anyone else wants to share an example of right question according to them?
Ma'am,
Yeah.
am I audible?
Yes, yes.
Ma'am, more than 90% farmers have less than 2 hectares of land. So they need to increase their profit. So they need to yield more crops in less land. So there should be some innovation in that field also.
Yeah. And how would you go about finding that? How would you go about finding the solution for this?
Like to study the soil, what can grow, which is then the rainfall and all patterns.
Yeah.
So
And
Ma'am,
talk to farmers.
contract farming.
Using rotation of crops.
Yeah.
Ma'am, the land
And
isn't the problem. There are already many solutions like multi-story farming, something like that of multi-story parking. We just need,
Ma'am,
we
contract
don't need.
farming can be done.
carry on.
Ma'am, contract farming can be done, ma'am. In recent days in MP, one particular district was shown to have contract farming, and their farmers have been, getting benefited twice as compared to national average.
Okay. That's good. So see, it
Ma'am,
depends.
now only their political party is opposing.
Yes. So these are different players that come into picture when we talk about a lot of problems. And
Now recent farm bills over which there is a rift between the center and farmers of Punjab, Haryana. So, ma'am, are these beneficial or not?
so the thing is that central and state government usually, which is actually beyond the topic of this module, but they are usually not found to be working in consonance with each other. And most of the problems that Indians face could be attributed to this rather strange relationship between center and state. But I encourage you to focus on a particular area in your jurisdiction, maybe, and try to convince the people who will be funding you ultimately. And if you can convince them or identifying the relevant stakeholders and sell your solution, but always remember before a solution is sold, the problem is solved. If I'm not convinced of the problem, even if the solution is mesmerizing, I will not buy that. Because the problem according to you and the problem according to me, if I look at the stats, might not sound very relevant. So, for example, let me give you an example. 4 years back, I was in a tribal area working with a team which was distributing mosquito bed nets in the area. So that area was endemic to malaria. This was Gadchiroli, if you know the Naxal area. And there, a lot of villagers had come. They had assembled in particular house, and the moment the bed nets were being distributed, the family details were being filled in a form, and then there were a lot of forms around 100 and 150 or more than that, 500 actually, and these were to be handed to the statistical team of the NGO that was working in that area. So the problem that I identified in there was that there might be a discrepancy in transferring the data from paper to computers, and also the time it takes first to fill the written form and then to feed the data in the computers. So, and there in that area there was no network also. So the idea that immediately came to my mind was perhaps automate this whole process, provide these people not with forms, not these people, the people who were distributing the bed nets, because these were the ones who were filling the forms, provide them with a tablet, make a form based app, and when all the data is entered, stored in the cloud, which will get synced up when the network is available, and it automatically generates the Excel sheet. Right? So the thing is that when we keep our eyes and ears open and actually observe what is happening around us. For example, in your own house also, there might be some problems in the kitchen that your mothers will be facing that you feel is the right thing to solve or the right problem to solve. Right? So there is no dearth of that kind of questions or situations. What we need to do is something that strikes us, we pursue that idea. So focus on the root cause of the real problems within the constraint of accessible resources. So,
Ma'am,
yeah,
I have an example, but I'm not sure if it qualifies on right problems and wrong problems.
go ahead.
So a month back, I read an article that said that it was a news agency that was saying that the government should provide free internet or internet at less cost to children of rural areas, since every education is going, classes are going online now. So I think that is a problem, that is an example of wrong problem, since internet is secondary, but first they must have PCs or laptops or smartphones to access the classes, then internet comes.
Yeah. So here I think there is a dependency, because the way we are trying to deploy our solution is dependent on some hardware or some resource that people already have. And if we find that they don't have it, then perhaps that becomes our primary problem. And if once that is solved, or at least we are assured that around 80% of people, students in the rural areas, have access to smartphones. But there are certain areas we don't have network also.
Yes.
There are rural and tribal areas where people live, but there is no mobile network. So that is also, these are very real problems that we are talking about. And in fact, this reminds me of another visit I had made in Odisha. So this was a school, a tribal school, and they had all the internet and everything. In fact, mobile network was also there, but there was no electricity. So you see, a lot of parameters come into picture for a solution to work, and if any of the link in the chain is missing, it becomes the weakest link, and then it has the ability to destroy our solution. So that's why I think at every step at how different pieces of the puzzle put together make your solution. When we talk about agriculture, we talked about land, technology, and everything. Talk to farmers also, because these are the people who have been living farming for long, and they might know their soil and the weather and problems that they are facing much better. Similarly, for people who are differently abled, they are living with that kind of problem for a long time, and they might know what the problems they are facing. This is called as ethnographic study. Please read about what is ethnography. You will get to learn about it, and then realize that how ethnographic studies and the results from that help us to improve a solution. And yeah.
Ma'am, but the government officials have the access to the information, so they can distribute among the people which are not aware of the things, but they are not doing their jobs.
Yeah, so that is a question of accountability on their parts, and also calls in question the integrity. So there are multiple problems, and you are bringing absolutely very relevant and real life challenges that impede the implementation of a solution, even when the solution exists. There are a lot of layers and strata to this. Yeah. Anyone else was saying something? So when
Ma'am,
we yes,
incident in my locality took place in which the government officials misleaded the people and made false statements which were not relevant to that thing, and people were misled by those things also.
yeah. So what was the implication of this false information that was circulated?
Ma'am, the doctor of animals, so the cow was having some issues in it. So the doctor told the person that it will not live a long time. So he told the farmer to sell the cow, and he sold it to to a person who is like the butcher shop. Like there are some butchers, you know, na.
Yeah.
Yeah. So he told to sold them, and that was not relevant to the thing. He could have treated the cow.
Yeah. So it's an example of professional misconduct, right? And so a lot of these factors you will also experience when you talk about among your team members. And so think about the barriers to your innovations. Think about who could possibly prevent it from implemented, and think about how you will get through that or how you will negotiate with them and still, pursue your solution. So most common types of innovation, especially in healthcare, are product innovation when you are developing some new drug, the process innovation in which you are trying to improve a certain kind of process to ease the life of maybe inpatients or OPD patients, position innovation in which you perform some electronic monitoring of patients formerly admitted to hospital, and paradigm information in which patients driving an idea opportunity generation within the health organization. So, so what do you think? How relevant is process innovation and position innovation in the times of COVID?
I think that it's the position, especially the position innovation is very important in times of COVID, since as not if someone has some other problems, not COVID, a flu or some ear problem or some throat problem. So we have developed ways, the doctors and the normal clinics have developed ways that they can remotely see the patients, and they have developed their own applications and techniques so that they can analyze the and see the patient from their own house and the patient
Absolutely.
sitting in their house.
Absolutely. Very beautifully explained. Thank you. Anyone else? Think about process innovation. Any example that is coming in your minds in which you are taking an existing process and looking at the current loopholes and trying to improve that process altogether. So think about EMRs or PHRs, electronic medical records or public health records.
We should privatize those government agencies which are not working properly.
But the downside of privatization in healthcare is money goes from people's pockets. And
we can put the limits and barriers over the rates.
yeah, ideally that would have made a great solution. But if you look at the privatization extent in Indian markets today, you will notice that
India is not able to grow, ma'am, just because the people have created a perception that government is not doing work. Government agencies. Not even it is perception, ma'am, but it is reality. They are not working.
Yes, ma'am. Most of the checkups are done. If one can do, then they are done in private hospitals and private clinics also.
So I think the topic that you have raised of
Delhi model can be followed in whole India.
Ma'am, that is happening because the doctors in government hospitals are getting less paid, and in private hospitals they get heavily paid. So people try to move to private hospitals.
Yeah. So see, in this very small discussion only, we are able to understand that why government infrastructure and people are not performing as they're expected, and why this draining of good doctors from public sector to private sector is happening, and what could be done to improve it. See, money is a significant part of the equation, but there are things even beyond finances which play a very critical role in why all this is happening. So for example, let's say when we talk about process innovation, there are many government hospitals which have partnered with other diagnostic labs to ease the pressure on their diagnosis, and so that patients can be referred there and get their tests conducted. So that will lead to less hassles for the patients and quicker solutions. So that is one example of process innovation. The big level problems that we are talking about, they are most problems relate to the bureaucracy of the larger area that we are living in. That is why we need to break down from the broad problems to narrow down problems where we can actually do something. These problems are very much debatable. We can write books on essays on them, and they are very extremely important to be discussed. Please do not think that I am trying to downplay them. They are extremely important discourses. And but when we focus on developing a solution, we should be aware of our resources, our team members, and our strengths. Using our strength, what we can do to solve at least the piece of this puzzle of a particular solution. And that will definitely help people. Right? So when you and this these types of innovation, again I'm saying, do not think of them as only limited to healthcare. When you are formulating your own projects, think about whether it's a product innovation, process innovation, position or paradigm, or something beyond that. So this is a basic framework that is generally discussed when we talk about innovations in health. So as you can see, that first of all, we should be very careful about the health value of that innovation. How will it impact the population at all? What is the relevance of the problem? Are there any ethical, legal, or social issues? How will it solve the health equity? So, what's the difference between inequity and inequality? Or put the other way around, what's the difference between equity and equality?
I'm not sure, but I think equality means that everybody gets in. I'm taking the context of resources, that everybody gets equal resources no matter what, and equity means that we'll see the condition that everyone has and then distribute the resources accordingly.
Very beautiful.
A fair mean.
Yeah, you have explained it very beautifully. So let me show you using a graphic here. Is this visible? Is my screen visible?
Yes, ma'am.
Yes, ma'am.
That image is visible?
Yes, ma'am.
Yes,
Yeah.
ma'am.
So read it and try to understand the difference between equity and equality. So as my fellow student mentioned here, when we divide the equal resources, they might not benefit these people. But when we are thinking from equity point of view, here our outcomes are equal. So similarly, in the healthcare domain, health inequalities and inequities exist. And your solution must focus on how it will be fair to everyone, so that those who are actually expected to benefit from them irrespective of from where they are starting. So these things come very frequently when we talk about innovations. Innovation should not be the preserve of only those people who can buy it.
But
You
ma'am,
know,
if everyone will get same opportunities, then people will stop working hard.
so you think this person is not working as hard as others?
Yes, ma'am.
It will depend
That's
on the
what I used to
situations.
hear that.
The first person must have worked hard to increase his height.
So let's say the height stands not for the height, but for example, let's say it starts with education. Okay, so uh, differences start very early in life. People for example, this person who has stunted height, perhaps he was born to parents who were poor. They didn't have food, and that is why he has developed stunted height over a period of time. There was lack of protein or nutrition in his or her diet, and that is why this person has not been able to grow. So there are factors even beyond people's control that considerably influence the quality of their lives, the socio-economic position in which they are living. It is not always about an individual's ability.
Ma'am,
Yeah.
I think equity is good, but it should be reviewed time to time. Like in our country, the reservation system is there, so they have given equity, that they have provided reservation to different castes and EWS. But the thing that they want, the main thing that the students that don't get opportunities were mainly because that they were not born in a rich family, or they were born in a very poor family. So the government introduced the EWS reservation so that they can get better opportunities, but they left the old reservation system as it is. They just introduced a new system, and the students who were not who are not born in a poor family, they also get opportunities. So it kind of creates an unfairness that they should review it.
Yeah. So I think after regular period of time, we should be able to see that are the benefits that are envisaged for the beneficiary are actually reaching them. If they are reaching them, fair and fine. After they have received, have their lives improved? And then re-examination, re-evaluation, in fact, for that matter, for any policy is very important. So why do you think there is opposition in the parliament? Because without opposition, we will never learn, and opposition pushes the party in power to think about their programs, their strategies, and that is how evaluation is very important. So the point you raised is extremely relevant, which is not very well prevalent also in our times. But when we think about any solution, these aspects, for example, if you develop a solution for people only of who have the highest height, then you are essentially losing out on not only your customers, but you are also losing out on opportunity to create value in the life of two-thirds of your population, and ultimately also then revenue. But obviously revenue is also important when you talk about innovation. So these things you must think about deeply. So coming to the economic value of a solution, again, we all know we live in a resource constrained environment, and especially in these times where fundings have drastically decreased and the markets have been hit very badly. Talking about innovation will come with its own share of how to reduce the economic burden of that solution, how to spend our resources very wisely, and then how the innovation impacts environment. That is called as eco responsibility, because as the world is becoming increasingly industrialized and urbanized, there is evidence that says that the natural ecosystem of our planet is also getting deteriorated And that is why we should be careful about that aspect also. Other than that, there are organizational details that need to be there. And talking about inclusiveness. So, inclusiveness means not leaving out anyone. Now, when we talk about innovation, there might be situations when we cannot cover all the sections or all the clusters in our population or in our society. And that is why this is a very important aspect. So, for example, there is a solution that you have made which is only applicable to people who are 80 years and above. But even in that sector, it should be inclusive. That means for people who belong to 80 plus years, your innovation should ideally reach people who belong to higher social economic status, moderate social economic status, or low social economic. So it should not, ideally, I'm saying, not differentiate between people's ability to buy your solution. But if that is a barrier, then again, it always comes down to your team that what is more valuable to you. These are certain decisions that need to be taken when in a commercial sort of environment when we talk about innovation. This is just a detail of the framework. Now we will be discussing about certain ideas, and I will be showing you some videos about the most recent and most common innovations in healthcare. But before that, I want to show you a graph. Anyone who wants to interpret this graph?
A prediction of how chronic condition percentage would have been in the population.
And what do you see?
It is increasing.
Look at the numbers.
It is predicted to be increasing.
In 2030, almost 50% of people will have some sort of chronic condition. Half of the world will have some sort of chronic condition. Now, there is a list of chronic diseases: diabetes, cancer, heart disease, cardiovascular disease, schizophrenia, Alzheimer's, Parkinson's, all these diseases, and a lot more. So, this graph alone tells us the burden of chronic diseases in our times to come. And each disease impacts a person's life in multiple ways, and not only the person's life, but also the lives of the family, relatives, and a lot more. And that is also one of the reasons that we would like to look into depth of how we can prevent these chronic conditions. And if the chronic conditions already exist, how can we prevent the complication that happens after these chronic conditions, as we will talk about in our lecture on geriatric care, that how old people with chronic conditions, how multiple innovations have eased their lives. And healthcare is a huge market. But the thing that not many people know in healthcare, which I want to tell you, is that most people are running after only the technical side of the solutions. And that is important. But what is actually also important is how is that technology creating an authentic value in the lives of your patients? How is it actually useful to these people? If the technology is there, is it accessible, affordable, available to them? Ultimately, our solution has to reach the neediest of needy people. We don't want it to get lost in some hackathon in which it wins the prize and then it's just consigned to history. We actually want it to come out among the people, help them, and create a better lives. And this healthcare domain is a culture which is very new to innovation and provides a very good opportunity to create some value using our academic learning. So these are the few examples that we will be discussing.
Ma'am,
Yeah.
I think the last graph that you shown was for some particular country because it's not of the world, as 171 million people is 49.2%. So
Possibly. Let us look at the source.
I think it's of maybe of US because it's 330 million
Yeah, so
population.
most of the data that we have in the field of healthcare come from the US only because they have proper maintained databases and all. So you're right there, but somewhere I think it reflects, even if we don't focus on the numbers, I think the
Yeah, I'm just saying
conclusion is
that the
pretty clear.
numbers may be more as US is good in healthcare.
Yeah. So in fact, yeah.
No, ma'am, but then the thing being that these might be the case because of the increase in the diagnosis and the interventions we are
I
having.
was coming to that. Yeah, that is true.
Uh,
So, as our ability to diagnose problems have increased, there are cases of overdiagnosis also. And detecting a disease is not very simple affair now because there are multiple symptoms associated with a particular disease. So for now, even if we don't focus at the numbers and we are questioning the accuracy of these numbers, I think one thing which should pretty much hit out very clearly is that the burden due to chronic diseases is bound to increase in times. And if you look at the last 20 years diabetes prevalence in the world and now, and especially in India, it is rapidly increasing. And our health systems may not be equipped to handle it. And because particularly, when we talk about India, people in United States of America or United Kingdom are still getting aware that how multinational companies which are selling foods high in fat, sugar or salt, they are harmful for them. And that is why MNCs which are seeing that people in these areas have become aware, they are looking to the markets in the developing world where people are not that knowledgeable, not that aware, and they are starting to establish their firms and franchises. So, for example, if you look at the number of McDonald's restaurants which have increased in our country for the past, I think not even 15 years, you can see that even in the smallest city where there was no McDonald's, now there is a mall and there is McDonald's. So, with urbanization and industrialization and globalization, of course, the lifestyle of people has changed, and because of the some sort of irresponsibility only, and that is why there are multiple partners that influence the eating habits of people in the name of making profits and then put them at higher risk of poor health.
but then, ma'am, this is the responsibility of the government or maybe someone else to make people aware about it. So,
So India,
Biased research is also a problem.
you see, it's not that easy. If you look at the history of 2019 draft regulation of nutrition that came in India, it says that within the distance of 50 meter from schools, there should be no McDonald's or anything like that. Now, within 50 meters, that means 100 meter is fine. 50 meters is hardly any distance. And if you look at the history of this draft, which is yet to become a law, it is dependent on the public interest litigation which was filed in 2010. The proposed distance in that litigation was 500 yards. It's approximately 478 meters. After 10 years of discussions with both the industry people, government people, and Ministry of Food, the distance has been reduced to 50 meters. You think people are aware? People are not aware. People are not questioning that. So, as much easy it may seem that we should include government and all, these processes are not at all easy. Only
but
evidence can help in bringing out a clearer picture. Yes.
true, ma'am. But then eventually, if we expect from a boy or a girl from class 6th or 7th that he or she should be aware that eating McDonald's is not good for his or her health. So that is I think that is too much that we are asking
But I
out
think
of him or her.
probably it's the parents' responsibility somewhere also.
True. So, but then that's the thing that the parents should also get aware about it. But I don't think that there are any upcoming events from the government or from the Indian industries to set up more chains like Wango, for example. Wango is a very good example of the South Indian chain in India, right? So maybe they could, you know, use their marketing strategies to promote these kind of things that something which is Indian, but still it's a fast food and it is good for a health.
Yeah, that could be one innovation.
So that is something which should be done.
But then again, the question comes: why would people want to go to Pangos and why not the other restaurants? How will you encourage people to change their behavior?
Ma'am, somewhere or the other, like PETA or other NGOs, not NGOs, basically, these organizations are working for something or the other, and they're working in the same framework. Like, people do change after reading or viewing the PETA articles. They do change their diet to and convert themselves to vegan or vegetarian.
That's what we think. That's what
Hmm.
we would like to believe.
Hmm.
But there are several models, trans-theoretical model, for example, which says that there is a particular journey that has to be taken from knowledge to action, which converts into behavioral action. And people actually struggle a lot. So for example, let us take an example of Chile. Chile, your country, it's in South America.
Yes, ma'am.
Yeah. So that country is suffering from a very huge burden of diabetes and obesity. You know what the government has done? Government has started taxing the soda and the coke. So people
Hmm.
who buy the sugar sweetened beverages, they have to pay additional taxes, and that is how they are preventing people from buy all these kind of things. So sometimes it is like a carrot and stick model,
Hmm.
right?
Maybe, yes, ma'am. This was something related to what China did when their population was
Yes.
right.
Yeah. So as we can see from our discussion that there are multiple barriers and also multiple ways to tackle the solutions of these are not simplistic problems that we are talking about. They are very complex real world problems, and even if we can narrow down on a one very specific, no matter how small problem, and study it through and through and try to identify some kind of solution, it will create a lot of value. So we will be discussing about some ideas. In the beginning of the lecture, someone had suggested adverse events prediction using the data logged in fitness apps. One thing that I really want you to read would be see the how quickly people stop using fitness apps after the time period of 6 months. And even though the fad is quite relevant, I've myself worked for 5 years in fitness industry, and the data on the server side and client side shows that after a period of time, interest loses, and that itself is a door for innovation. Ask why. How to retain people's reliability on the fitness apps. So how to make fitness apps stay relevant even after 6 months or 1 year. The fitness app should ideally be equipped to give something newer insights, personalized recommendations to the user of that fitnet wearable or app. And that is how innovation is not only about creating a one-time solution, it's about how to keep that innovation relevant in the times to come. So if we talk about Nokia, right? Nowadays, who uses Nokia? What was the reason behind the downfall of Nokia?
Other companies made better
Lack of
smartphones.
innovation and research.
Yeah, they were
Price issue.
They couldn't adapt to the modern operating system market. They didn't accept Android system, so
Yeah.
they became popular.
Their denial and refusal to change their ways led to their death, right?
Yes, ma'am.
So,
Ma'am,
and
but
this
for Apple, it was beneficial then.
what?
Ma'am, like Nokia did not accept to use Android, so Apple made their own
Yeah.
softwares, and it was beneficial for them.
True. In fact, when Android is also given by Google, right? And sometimes Google threatens to um, prevent Android to any outside companies because Samsung also uses Android platform for its development. Now Samsung has started to develop its own platform to make.
Ma'am, one case is an interesting case of Chinese giants Huawei, who were denied services by US clients, and so they have started developing their own operating system called Harmony OS. There was a big, problem there.
Yes. Yes. So each of the organizations in their own manner, they don't want any sort of dependency on the external parties. And that is why they are trying to become more flexible in developing their own systems. So these are the 5 videos I would like to show you. Let us see them one by one. So this is about, so there's a prominent problem that when we go to multiple doctors, multiple clinics, our data is very fragmented and heterogeneous, and there is no proper repository in which all our records are there, so that tomorrow when we go to a new doctor, he or she can look at the history of our diagnosis and our visits and then come at a more accurate diagnosis. This video talks about that.
Healthcare delivery, despite billions of dollars invested in new technology and electronic systems, is disconnected, fragmented, and complex, making it difficult to deliver care. For any patient, providers have to search for information to fully understand the patient's condition, which can take hours of time and lead to an incomplete picture. They only get occasional glimpses during sporadic patient visits, not a whole continuous picture. This wastes time, increases care costs, and prevents optimal outcomes throughout the patient care journey. Worse, it makes it impossible to give continual proactive care for a broader population. NoteWorth solves this problem by giving providers one platform for all aspects of virtual care delivery. Providers can optimize how they care for patients and improve outcomes with a view of health that's not limited glimpses, but a complete picture for every patient. To create that complete picture, NoteWorth aggregates clinical data, collects patient-generated data, consolidates it for providers, and ensures that it's updated and actionable. Providers can see when intervention is needed for both acute and chronic conditions, helping the right clinician make the right intervention at the right time, like adjusting treatment plans even without needing a patient visit. NoteWorth enables providers to take action right in the platform through whatever engagement method is best for the situation. Beyond virtual consultations and diagnoses, clinicians can continually engage patients with a more relational connection and ensure effective outcomes through a specialized patient app that's tailored for specific health needs, creating a focused experience that yields extremely high adherence rates. All in all, NoteWorth's platform leads to increased efficiency for providers, increased engagement for more patients across more of the care journey, and improved outcomes. NoteWorth is the only platform that creates continuous engagement for both patients and providers. Learn more at noteworth.com.
So all of you were able to watch this video?
Yes, ma'am.
So what do you think was the problem that was identified by this firm?
Previous data.
Previous data of
So let me put it this way. Do you feel that the problem that they are targeting is a right problem? Are they asking the right question?
Yes, ma'am.
Right. So the thing with clinical data is that a lot of data is getting accumulated every single day, even a person all around the world. And that presents itself a huge opportunity to use that data to create some solution which is relevant either in process innovation or paradigm information, ultimately useful to the patients. We'll watch another video which talks about tracking medicines. Sometimes people forget to take their medicines on time. And this startup talks about this.
Ma'am?
Ma'am, we
Yeah.
have
Ma'am, we have an class at 5. Another
You have a class
class
at 5?
Ma'am, 5:30, but we have continue classes from 2 o'clock, so we need break.
Okay, sure.
So we
So
can
then
continue next
perhaps
class.
then I will take up this lecture because we have some of the discussions pending. So we will take forward this lecture. I will anyway, then after I will upload it. So possibly Friday, tomorrow, is it possible for all of you to meet 4 to 5?
Yes, ma'am.
Yes, ma'am.
Okay,
Yes, ma'am.
awesome.
Ma'am,
Then
how
tomorrow,
about 3 to 4? It would be in a flow, I think so.
tomorrow 3 to 4?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
All of you will be available?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes, ma'am.
Awesome. Then we shall continue our discussion 3 to 4 tomorrow. Okay?
Okay, ma'am.
Okay,
Thank you
ma'am.
so much. Thank you. Yeah.
Thank you,
Thank you,
ma'am.
ma'am.
Thank you.
Thank you, ma'am.
Thank you. Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you. Thank you for letting me know.
Just a question, ma'am.
Of course.
Ma'am, the video which you showed us just now about the business model, about the